Morning, everybody. I'd
Morning.
like to call to order the Public Health Committee for Wednesday, March 19th. I'm Cheryl Strathman, Chair. Attendance, please call the roll.
Arroyo. Arroyo. Doobie.
Here.
Genesis.
Dennis is here.
Carver.
Carver's here remotely.
Young. Sanchez.
Sanchez present.
Strathman.
Strathman here. Okay. And Mr. Arroyo, are you wishing to participate this morning? Okay, I guess we'll hear from him. Mr. Arroyo, you are on mute.
Oh,
Can you hear me now?
Okay. Did you wish to participate this morning?
I'm out of town.
Oh, okay, so that doesn't qualify. So, well, thank you for joining us. And I'd like permission from the group for Mr. Tarver to be in remote attendance. Well, Josh Gaines, okay. Good morning, Mr. Tarver. And I would like to have approval for the minutes for February 19th, 2025. Do
Sanchez moves.
I have a second?
Do we do unanimous consent?
Yes, we could
Yeah.
do.
Oh,
Is that what you
yeah,
meant?
sorry. I'm not awake yet. Sanchez asked for unanimous.
Unanimous
Approve the
consent.
minutes.
Any objections? Okay. Before we get to public comment, I would just like to say that today is National Let's Laugh Day. So let's laugh. It also happens to be National Chocolate Caramel Day, so it might help you laugh if you have chocolate caramel, right? So, okay, now on to public speaking. I didn't get the laugh I was expecting on National Laugh Day.
No, no one laughed.
Tough job. Keep trying, Cheryl.
We're saving it.
Okay, don't forget the chocolate caramel, right?
Yes.
Okay. All right. Mr. Meyer, Mr. Mike Meyer.
Still in the Illinois Senate that everybody going to college needs.
Is the mic on?
Is the microphone on? We're having a little trouble hearing.
Okay, I've got a greener.
Go,
I
there we
can
go.
hear myself. Hey, reading that there's a House bill in Illinois to mandate Tdap shots for everyone going to college. The Tdap shot has a special place for me because it probably killed my first wife. Second aspect about mandating shots, we had a whole lot of those in the military. Anybody you who have served, yeah, you know how that goes. Headquarters says you get all your shots. Remember Desert Storm? A lot of guys were catching up on their shots. I was just finishing up my tour of service. Some of the guys in the squadron catching up on their shots, get 3 or 4 shots catching up, and they are medically disabled. They're a casualty. United Airlines did that. Everybody gets the COVID shot, otherwise you're fired. I retired early, and that was a $30 million lawsuit for them. So I would advise against mandating a shot. Thank you.
Thank you. And next we have Jean Meyer.
Good morning, Jean Meyer, resident, RN, MS, and thank you for not having the COVID vaccine mandate like DuPage County and Cook County. We need full informed consent for our vaccines to show their side effects and also to be given information how and when to contact VAERS, the Vaccine Adverse Event Reporting System. Yes, we need to use that. And I thank you that you have put it on the website. Thank you. Thank you. Okay. The Tdap vaccine makes Illinois news as a public health issue, Mike just said. This forces students to choose between their future livelihood and injection of this vaccine versus their refusal and perhaps no college. No one ever hands the vaccine recipient the vial insert, asking them to read the side effects so they can give fully informed consent. Not at all. I've never seen it happen. No one tells them to report serious side effects to VAERS. They don't even know their side effects of the vaccine because they assume their doctor would never give them anything that would cause harm and not tell them. My husband never did. He never did report to VAERS. No one told him that the Tdap that he and his wife, my friend Kathy, took had serious side effects. When they were told to see their new grandbaby, they must have the Tdap. My friend Kathy, my husband's first wife, had a heart-lung condition, leaving her blue and on oxygen, and yet, by the grace of God, fully functional. She was amazing. Oh, man. Here we go. She was the very class of people that public health officials recommend having every vax because she had those comorbidities. She phoned me after getting that Tdap shot. She said, I need prayer. I am so sick from the Tdap shot. I'm afraid I won't get to see my new grandbaby. And so we prayed and she went. Mike got hit very hard as well by that Tdap shot. And let me tell you, he's got the constitution of a young horse. She did fly to see her new grandbaby. Mike's youngest daughter cried like a baby when they left. She said, I knew I would never see my mother again. They were doing a puzzle of the United States and Kathy was putting states in some very unusual positions. She wasn't getting enough oxygen to her brain. Kathy died in the hospital the very month she received that nasty injection. Mike, not being informed about the side effects, did not even know or report that this had hastened her death. Thank you. Make sure we fully inform people, give them the side effects, give them the contact information for VAERS. Let's be scientific.
Thank you. Okay, the financials are in your packet. Were there any questions? Okay. And so we're going to go to Mr. Brett Youngstadt this morning.
Good morning, everyone. My monthly reports are on file. I have nothing new or exciting this month, but we are exciting to start ramping up. As the warmer weather kicks in, our numbers are starting to climb, so we expect that. Kitten season's coming too. We're excited to release our vaccine clinic dates. Blair, next slide, please. We did 2 versions of the flyer this year. Either one you pull up. Blair, can you flip to the other one too, please? We did 2. It's amazing when you go through your staff and start to see what kind of skills our staff here at King County have. One of them is very artistic. So we did 2 flyers this year. One that's more comic book style, which has been great with, we've noticed a younger crowd. And the other one has been great with our regulars and our routine visitors we're normally getting. What we're always trying to do is make these clinics bigger and bigger every year. Every year they continue to grow. Every year I bring you guys the numbers showing that, and it's fantastic. We love it. We're glad that more and more people are coming to this. So this year we took the approach of let's try 2 different flyers with 2 different styles. One kind of the jokey comic book style versus one our standard routine. And again, hoping to get new people is our goal at all times to get the word out about what we're doing. So we're trying this. Again, you got to try something new because you don't know until you try, sort of moment. Our first clinic will be held Saturday, April 26th. That's going to be from 10 o'clock to 1 p.m. Our second will be Wednesday, May 14th. This is going to be from 4:30 to 7 p.m. And our third one will be Saturday, June 14th. That will also be the 10 a.m. to 1 p.m. We're hoping to put out the rest of the dates soon, but with our veterinarian leaving, we're a little unsure how the rest of this year is going to look. So as soon as I can get those dates released to you guys, I'm very excited to get that done. This has already been released to our partners in the seniors communities. We're getting it out to the libraries now, so we're very excited to get this information out to the rest of the county as fast as possible. If anybody has any questions or concerns, please let me know.
Yes, Ms. Shuby?
Thank you. Kind of a back-to-back question. Who is our veterinarian and what's our process for hiring a replacement?
Dr. Jane Davis, who was
It is
also the
still
head of
Dr.
biology from
Davis.
Aurora. She retired at Aurora last year. She has a grandbaby now, taking a lot of her time. So she's finally hoping within the next week or two to put in her resignation with us. So we're preparing for that. Our process will be the same of all of our hiring, except this will be blasted to multiple AVMA, ISVMA, the other veterinary sites as well. We do have a couple local veterinarians that are very interested in this position. A couple have already spoken to me, so we're very excited to get that process started. Not excited to lose Dr. Davis. Let me please rephrase that. She has been with us 21 plus years. She has done a phenomenal job for this county. It's going to be a huge loss, but we're excited to start the process and see what the future holds, sort of thing. And I'm sorry, your other question, did I get them both?
It was it. I wanted to know if
Sorry.
Dr. Davis was still the veterinarian.
Yes.
It's been a long time. And then I just want to know what the process was. So you don't anticipate like a huge lag?
We're hoping not.
Okay.
She's giving us 3 months and actually a TBD.
Okay.
So TBD is she's not looking to run away. She wants to make sure the county is protected before she leaves.
Great. Thank you.
But we also want to respect her time and move with it.
Yeah, those grandbabies are important. I have a unrelated question.
Yes.
I love reading your reports every month. And I am curious what the others are when you report your bites and what kind of other animals do you account?
Occasionally we'll have the horse or two, we'll have a cow. We do not this month. Our big ones this month have been, we just had a muskrat. I may screw that up. That came in this weekend that bits 2-3 dogs. But for the people, it's usually raccoons, wildlife, other exotics, farm animals will all fall into that other category.
I was just curious. Yes, Mr. Greig.
Thank you. Brett, I was curious, a couple of constituents asked me, they have houses elsewhere as well as in King County and pets.
Mhm.
If they register, and this 2 ways, I guess it would be, if they register in King County and have their tax and everything, will that satisfy XYZ County in Iowa or Wisconsin, let's say, or conversely, if they register their pet in XYZ County in Wisconsin, will that satisfy King County?
Perfect. So I can't speak for other counties and what they will and will not accept. Well, all I can speak is on what this county does. What we tell people is, because we have tons of people, especially that live in Florida half the year.
Yep.
What we always say is, where do you spend the majority of your time? If you're spending 6 months and 1 day in Florida, then register in Florida. Again, we're not out. I'm sorry, there's a squirrel carrying a bunch of leaves, building a
Yes.
nest that just drew my attention. I apologize. A squirrel, I get it. Yeah, I fit in my industry perfectly.
Squirrel. Been working on his nest
Squirrel.
for a
But
week.
we tell people that wherever the majority of your time is where we want you registered. Because the key at the end of the day is, are you registered? Of course, Illinois would love everybody registered for every animal that even drives through our state. Who wouldn't? But realistically, where are you spending the bulk of your time? If you're telling us you're spending over 6 months here, then we tell you to get registered here. Because if we pick you up or someone else picks you up, that's gonna be our first question is, where's the majority of your time? It's in Florida. Cool. Can you show me you're registered, vaccinated? We're happy.
Thank you.
Hopefully that helps.
Yes, Mr. Bendis.
Yes, so with these vaccine dates, this is like a yearly thing. What has been the response you've had as far as turnout for that?
I would love to send you my presentation, just because you missed last year. I don't have them right in front of me, and I'm so
No.
sorry for that. But every year we give out, I think this year alone, I've ordered over 300 vaccines to start, and I know we're going to go through them all. We're averaging about 100 microchips per year, and we do microchips every day that we're open. We'll do a microchip for someone. Still at the clinics, we're doing about 100 a year. We're averaging about 300 to 500 vaccines, but the full breakdown, I just don't want to misspeak to it for you.
Understood.
It's very impressive.
Yeah. My dogs would be going crazy with that squirrel over there. That squirrel has been hard at work for weeks now.
There's a reason I fit into my industry so well. Like,
So you're just like a dog. Squirrel.
yeah.
But I want to say, Brett, I went out to visit the animal center, and it was just a fantastic tour that you gave me. Very excited about our facilities here, and you're doing a great job. Got a great staff over there. So thank you for that.
And thank you.
Appreciate
We
that.
loved having you. Thank you.
Yeah, thank you.
Okay, any other questions for Brett? Okay, now you do have a resolution today?
Yes, but we need to make a correction.
Yes, we do. We have a resolution in front of you this morning that powers of the universe decided to challenge us all and put a couple of extra sentences in it that do not apply to the resolution. So we're going to amend the resolution this morning so that what you have before you, which copy do they have? Do they have the amended? Okay, you have the amended. I will say you this, when the packet came out, under the summary of the resolution, 2 sentences were, I'll just read them quickly. Well, I don't think I need to read them, but there's 2 sentences that did not apply to the resolution. And we thought we could remove them, and we were not within the time limit. We should have done it on Friday, and there were some sicknesses going on and whatnot. So the resolution has 2 sentences that does not apply to the resolution, starting with the summary at the bottom. So we need to amend. We have the amended resolution in front of you. Wait, I have to get the right one here.
Is the one in the packet the original one?
The one in the packet that you got yesterday
The amended. yeah.
is the amended resolution.
So the packet that's online too?
Yes.
Yeah. Yeah. Okay.
Madam
So-
Chair, may I ask a question? Are we talking about something that we have to remove from the actual resolution, the now therefore be it resolved section? Or are we talking about the summary page, the addendum?
Of the resolution you got yesterday, it's in the summary that we left. We
On the executive summary addendum?
executive summary, we removed the 2 sentences that had nothing.
I don't think that needs to be, I don't think that needs to be voted on. The only thing that matters is if we're removing something from the resolution. The summary is our information.
Okay.
So I
think
don't want to
you're
be
right.
wrong, but I'm getting very confused about this. And so I don't, people who don't have it in front of them also are, but if we're not physically changing the whereas pursuant to the now therefore be it resolved, if we're not changing in that body, I don't believe that we have more action other than just accepting that resolution, because that didn't change.
That's correct.
If I may.
Okay, so did I hear another voice?
Yeah, I don't know how to raise my hand online. But I think Ms.
Yes,
Juby is correct. Yeah, we're not voting on summary, we're voting on the actual resolution. Ms. Juby is
Alex, could you
correct.
get a little closer? I'm having a hard time hearing you.
Sure. Maybe if I turn it. Can you hear me now?
A little better, yes?
Okay, no, I think Ms. Juby is correct. We're not voting on a summary, we're voting on the actual resolution. And we should move forward with it as is.
I'm having trouble understanding.
He's basically saying the same thing.
Yeah.
Unless we're changing the actual resolution, there's no need for any action.
So I'm just adding more confusion to the already existing confusion. And my apologies.
Just need some chocolates.
So we're all clear this morning, so. Was there a full moon recently? I'm thinking there was.
There was, yeah.
All right, I'm claiming it then. So we have a resolution. I need a motion and a second and then for discussion and possible passing.
Sanchez moves.
Hennis is second.
Okay. Brett, would you tell us what this is?
Yes, this is the discussion I had last week. We're trying to bring the DA license back into the county and not leaving it in the hands of one single employee that we're then at will of. So perfect example is our veterinarians leaving. When a veterinarian leaves, they have to take all DEA controlled licenses purchased under their license with them. So when she leaves, we're going to have a transition to a new doctor. That new doctor takes a while to obtain a DEA to our current facility. So what we're doing is we're protecting the county. And like I said, about 90+% of Illinois is already on this. We're just one of the last ones due. It was a matter of when was the time to change over sort of moment. With the changing of our veterinarian was the perfect opportunity to do this. Aurora's ahead of us in the process. City of Chicago is moving through it right now, and we're going to be moving through it right behind them. So hopefully the state moves quick and we can do this quick.
It makes sense not to have it with relying on just.
Correct.
one
It
person.
ensures it stays with the county at all times, and animal control will ensure continual operation no matter who's in this facility.
Okay, do we have any questions or comments? Okay, please call the roll.
Okay, Juby,
Juby, aye.
Genesis,
Hennis is yes.
Carver,
Carver, yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes. Motion passes. Okay, anything
you.
else today?
That's all I had today.
Okay, thank you.
Thank you.
And now we turn to Mr. Michael Isaacson, Executive Director of Public Health. Good morning,
Good
Michael.
morning, everyone. A couple things I wanted to highlight today is the weather's starting to get a little bit warmer. That means it's going to be festival season, where we're going to have a lot of mobile sites and temporary food events. So I just want to give a preliminary shout out to the fantastic team we have in our environmental health division at the health department, because when the weather gets warmer, they're busy all year, but when the weather gets warmer, this is nonstop out there inspecting to assure that the food is safe at any festivals or events or corn boils or whatever you're going to enjoy. So maybe we'll share some more information with some statistics about that. I also wanted to highlight, hopefully you saw in the Kane County Connects, or hopefully you're all following us on our social media, but the Kane County Chronicle just recently named the Kane County Health Department as one of the top workplaces for healthcare in the county for 2024. So that was really exciting. Yay. So I think it's a great testament to the great team we have in leadership and all of the great employees, because we were just talking about this yesterday. I think Director Elliman and I, you know, what makes a great place to work? It's the people, right? I always say, if you live in a great neighborhood, what makes it a great neighborhood? Like you like your neighbors, right? Or if you're antisocial, maybe you like that they don't talk to you. I don't know. But our workplace is not like that. Our workplace is someplace where we have a lot of really dedicated people who are passionate about their work. Over the past several months, we've been engaged in a process that we're calling life cycle. So looking at from how we recruit people for new positions on through to exit interviews, what are the data points that we can collect and what input can we get from our employees through that whole process? Because really the people who are out on the front line doing the work really have such a good understanding of what's happening. So we're making some really good improvements, I would say, and cleaning up some processes. And it's kind of the, you know, how the sausage is made behind the scenes type of things. But I think it's having a really good impact. And I think that people voted this is one of the top workplaces is evidence of that. I also did want to mention, though, just the ongoing measles outbreak that's happening in Texas and New Mexico and Oklahoma. So we're over 300 cases already, and you know, potentially 2 deaths associated with this. Over 10% of the people that have been identified as testing positive have been hospitalized. Again, I talked about this last month, but I think we're in a time where there's a lot of concern in the community about immunizations, and especially MMR, the measles and mumps and rubella vaccine. This is something that measles was declared eradicated in our country over 20 years ago. So the fact that we now have people dying from something that's completely preventable is very alarming. As we do see vaccine rates dip in different populations, that is very concerning. So I'm 100% in agreement that people need to be given all the information so that they can have an informed choice, as I've stated over and over. And we've done a lot of focus groups with parents who have concerns about immunizations. All parents want what's best for their kids. So we know that's our starting point. So we want to make sure that we're getting information out to people so that they know all the risks of disease and potential risks of any vaccine. In the case of measles, the risk of the disease, this is really a serious disease. And so the risks of the vaccine are minimal compared to potentially what could happen. So we continue to monitor this outbreak that's ongoing. We've already surpassed our total cases for the year nationally, and it's still just the middle of March. So this is something that's preventable, and this is just one disease. So we want to make sure people are getting the right information. Certainly with the VAERS and the informed consent, that's something that's critically important to us. So making sure in our immunization clinic, we provide people with all of the information about each vaccine, so they get a fact sheet and they get specific information about how to report into VAERS. So this is a system, again, as we talk about being alive here and now, 2025 in the United States of America, we do have really robust systems to be able to evaluate vaccine safety. So it is important that we have that opportunity. VAERS exists so that we can track these things for all vaccines that are out there. So that's very important. Also, last month, we talked a little bit about the type of information that would be helpful to see. I think Mr. Gripe's done a good job of kind of pushing to say, well, what are the top issues? And as I watch some other committees, I see, what are kind of the top line things that people would like to see. I started pulling a presentation together, and I think last month I commented that maybe we'd do kind of the fire hose technique this month, where we would just put everything out there. As I put the presentation together, though, I worried about context, because there's a lot of things we do that without an explanation, I think it's an incomplete story. So what I propose to the board is that we do a deep dive in programs, and this actually gets into something that I'd wanted to do, but have not done yet, where we really bring staff forward to celebrate them. But we also give a much deeper explanation of each of our programs over the course of the year, so that in a year's time, you have a really good understanding of all the different things we do, because this is a strength, and something that's a bit of a threat for communications for the health department is the way we're funded and the broadness of public health. We have, with our 25 plus grants, every one of those has different data that we collect. So it's pretty diverse in terms of the type of statistics that we have. Chair Strathman and I are going to meet up after this meeting, but if there's specific programs that people would like to hear about first, and we'll share over the next, and we can probably get through it, I would say, in the next 6 or 7 months. But if there's specific programs that you would like to hear more about, so that we can do a deeper dive, then we'll bring those first. And as we work through, if there's types of things that then you as the board members would like to see on an ongoing basis, as I said, when I was hired into this position, getting information to people, and we were, my friend has left, but Mark Avalar, as he's looking, we've talked about kind of the absence of really good granular behavioral health data at the township level as we have some of those conversations. That's something that I think the team sitting to my left here, Director Peterson and Director Alleman and Director Barrett and Director Onwuda, have done tremendous work in terms of bringing data forward. So I feel really good about where we are compared to where we were 2 years ago with data. So any groups that you have in the community, whether it's at the township level, certainly internally, we've improved our mechanisms for getting information together, but getting useful information, and this goes to all the conversations around vaccines too, getting useful information to people so that you can make decisions, that's one of my top priorities. So with that, if there is any conversation about what types of programs people would like to see highlighted first, I'd love to hear it, or you can let us know offline as well.
Any comments or questions about that?
I think
Yes.
that's a great idea, doing a deeper dive each month. I'd be really happy to see that. Do have one question regarding that measles vaccine. I know that the rates down in New Mexico, Texas area are like in the 80s. They say like 95% is where we want to be. Where are we at here in King County?
We typically are over 90% in most of our school districts. We do have pretty strong laws around mandates, and even though there are some abilities for exemptions for people, we still see pretty good compliance, but it has been going down. So that's something we can bring the updated data on, because yeah, like you said, 95% is what we go for. And with this outbreak that's going on, and it could potentially be similar here, you may run into pockets where the data that comes to us, most of it comes from school districts. So if we have people who are homeschooled, who are working outside of the schools, we don't always have the best handle on the vaccine rates in those populations, even though they may be most at risk. But we can, that's an area where we have a lot of data. And like you said, we actually did a project that I referenced with the focus groups. The timing was horrible, because this project was right at the beginning of COVID, but it gave us the ability where we had some resources to work with firms in the Chicagoland area to really sit and talk to parents who are vaccine hesitant. So not anti-vaccine, but just people who said, well, this seems like a lot of shots, or maybe I don't want to give all these shots at once, or I have some concerns. We started that right before the pandemic. And then as we met with people again and did focus groups, we saw that COVID was driving down or driving up anxiety, I should say, and driving up questioning of vaccines that maybe 8 months previously people were not sure on the timing of, but they were still willing to do it. And again, at the end of the day, parents, and there's a great commercial, maybe I'll bring, I don't know, I don't want to get tagged by YouTube for, well, I'll count on Blair because sometimes when we show videos, we get in trouble. But there's a great video online that I think really illustrates a group of mothers at a park arguing over vaccine or not, or breastfeeding or not, or all these, there's all these details we have. And then a baby carriage starts to roll away. And it shows how everyone there is going to save the baby. And I think that's the key. And I think for all of our discussions, and this is editorializing, but we ultimately want a lot of the same things. And we argue about a lot of details, but we want to protect our children. We want to protect our community, and we want to make sure that people have the information to make good choices. So I think we're watching the vaccine rates, and in the schools we do better, but some of those other populations, it's a little less.
Thank you.
Mr. Greip?
Thank you, Madam Chair. Michael, I think your department has one of the better departmental websites out there. I was wondering, back to Jean's comment, I would assume the side effect sheet, whatever that's called, is that something we could post for different shots on our website? So if somebody says, I don't know, so they could go there. Unrelated, I think your idea about the deep dive presentation is wonderful. Perhaps you could present a list of those for newer folks like me who don't know all those deep dive things. And then if there's something that say, wow, I'd really like to see that, they could help you prioritize. And also if they miss one, then they'd have a schedule once you develop that. So they could go back and look and say, well, I wasn't at that meeting or something, and I could go see it, go look, or point other people to it. I think it's a great idea.
Yeah, great. And definitely we will. During COVID, we had all the fact sheets posted for COVID vaccine, but we can certainly do that. We want people to have all the information, and I think transparency and that's why I held back today a little bit, because actually I made a little quip related to the JFK files that were related. Sometimes, the best transparency is just overloading people with information. I don't want to do that. We want to give you the information that is useful for, as a board, making policy decisions for our community partners, whether it's a township mental health board or whatever. We want to give you kind of the porridge that's just the right temperature, right? Here it is. It's just right with the level of detail, and a list of programs. I didn't even consider that. That's excellent. Yeah.
I'm looking forward to this. I think there's so many good things going on in this department that I want everybody to know about it.
Yes. And I am negligent because I think I did a better job 2 years ago, really highlighting our employees, because again, for any of the statistics, it's the work of our employees who are doing it. So to be able to bring people to the meetings so that you can meet them and see them, I think they're the ones who are doing the work. And I mean, the team here works very hard too, but we're fortunate to have such a great team. So excellent. We'll come up with a list maybe over lunch. That
Okay,
sounds good.
all right. So you have a resolution. Is that anything else before we get to the resolutions, or?
No, we are excited to highlight one of our great programs today, so we can
There
go
you
to the
go.
resolution.
Go ahead then.
So we have a resolution, and I think there's something coming for OEM volunteers separately. But as you may know, or maybe you don't know, Kane County was one of the first counties in the nation to have a medical reserve corps. So we started this about 22 years ago. We work closely with the Surgeon General's office, and actually would participate in helping other communities around the country in their applications in the building of their medical reserve corps. Over the years, our involvement has waxed and waned. The way it's been organized has changed. But during COVID, the Medical Reserve Corps stepped up in such a big way for us and was so critical to our work. And we have a fantastic team who's doing public health emergency planning now. So I feel really good about where we are. So we have volunteers that will come to the board meeting, and we'll highlight staff in just a second. Do I need to read it, or is that just for the board meeting? I don't know the process for proclamations, if it needs.
No, I don't
One
think we need to.
Blair. It's the one before.
But basically, this is a proclamation recognizing April as National Volunteer Appreciation Month, and we are specifically recognizing the Medical Reserve Corps. And if it's okay, I would turn it over to Director Alleman to introduce her team who's here, because they are doing a fantastic job.
Hi, good morning, everyone. Hopefully everyone can hear me okay. Just want to call out, so Kyle Griffin, who is here, is our emergency response supervisor. Kyle is actually himself a OEM volunteer as well. So Kyle's got a lot of really great emergency preparedness experience. He's been with the health department just under 2 years now. So I will turn it over to Kyle to tell you guys a little bit more about the MRC.
Thank you very much. Everybody hear me? Fantastic. The weather's going to start probably around 3 o'clock or so, hopefully. Well, hopefully avoid that as best as possible. I did want to highlight the MRC, of course, is that what we're here for? On the eve of the Volunteer Appreciation Month in April, during the COVID, our response to COVID, to the closing of the last vaccination site, we, as a volunteer organization in the KCMRC, serviced 11,246 hours from March 2020 to October 2022. During COVID, that's $384,492 that we saved the health department and the county at large with the volunteer service that was given by the KCMRC. Beyond what COVID brought to us, we are trying to re-envision and reinvigorate the Medical Reserve Corps. Last year, we contributed a little over $18,000 worth of savings towards the health department and county operations. If you are paying attention to some of us in the social media atmosphere, we just had some of our medical team out at the Polar Plunge supporting the law enforcement torch run for Special Olympics. They blew their $18,000 commitment out of the water with a $63,000 basically group donation to the Special Olympics. I thought it was very important that the Medical Reserve Corps be there and present for that as well. We are also in partnership with the Sheriff's Office administrating close to about 400 CPR students between the health department classes and the classes being hosted at the Sheriff's Office this month. So that is in collaboration with our Medical Reserve Corps volunteers, as well as staff from the health department and staff and deputies from the Sheriff's Office as well. So the MRC is dedicated in itself to a new era of really large and meaningful collaboration throughout the county. And we really wanted to highlight them and the continuous work that they do for us. The MRC on a daily and a fairly regular basis support a number of programs throughout the health department to include like our lead surveillance, our daily CPR training, Stop the Bleed, and most recently, a few of our MRC volunteers actually took our mental health first aid training just this past week as we kind of realized some of the behavioral and mental health aspects that are affecting our county and our citizens today. To the future right now, we are trying to expand our volunteer capacity and also expand recruitment. A lot of why doctors and volunteers, nurses, EMTs during the MRC during the COVID pandemic was basically a synonymous, asynchronous call to assist in something this large. And so a lot of our medical and logistics side of the MRC are kind of inactive. And so we're bringing that back, making things available for them to continue to service the citizens of Kent County. So we're really looking forward to the waves of progress that we're making as a volunteer unit, and looking forward to it. That's really it.
Thank you.
Thank
Thank
you.
you. That- Any questions or comments, Norm?
I got a comment.
Yes.
I
Mr.
just kind
Sanchez.
of wanted to add some of the praise just because, I mean, during COVID, whether, people agree with the shot or not, we were tasked with, supplying the demand that was out there, establishing that vaccine program. And there was a huge demand for a long time. And just firsthand experience, there's no way we could have pulled it off without the MRC.
Right.
I mean, it was just incredible how much they were able to come in, and I think we were still over capacity at times, and it was like, hey, we need to get more people, but we had so many good people. There was a lot of pride. That's what I remember, just a sense of these people coming in to help
Yeah.
and having that opportunity to do so. So not the circumstance we would want, but the fact that they were there and so able and willing, it was really amazing to see. So I can't say enough good things about that.
Thank you. Thank you for that comment. Yeah, I think it's all pretty impressive. So thank you
It's
very
great. So,
much.
and I just want to give a shout out. Kyle's done a great job since he's joined our team. I can't believe it's been almost 2 years already. Is that? Wow. But he brings a great background, as Director Element said, not only in terms of many years as an OEM volunteer. So there's bringing that culture to public health, which is always helpful as we merge and meld with the different cultures that exist out there. He also has Adi on his team who does an outstanding job. So as we talk about our programs, and we'll come and talk more in depth about some of our emergency plans, and as we're on the 5-year anniversary of kind of the big shutdowns for COVID, we've had newspapers reach out to us, and it's like, I don't think people really want to talk about COVID anymore. And certainly in public health, we're ready to move forward and talk about new things. But in talking to one of our local newspapers, something stood out is talking about, how were we prepared? What have we learned? And I think there's so many lessons in terms of engaging people and how we communicate. So the work that's going on all the time, we call it our FEP team, Public Health Emergency Planning. It's just really impressive what's going on there. So kudos to that group.
Thank you. Thank you. So are we ready then to vote on this resolution? Okay, do we have any questions? Do we
Yeah,
have a
just-
motion in a second? We need a motion in a second.
I think Mr. Roy's got a question.
I'll be very quick. As a
Okay,
new
Ms.
guy,
Royal.
can you hear me or not?
Yes,
Okay, as a new guy here, quick question. Does the emergency response team work with FEMA in case we were to have a natural disaster?
We do. So our emergency response team is part of the overall county response. So we work very closely with the Office of Emergency Management, the Sheriff's Office, et cetera. Depending on the nature of the emergency, we're engaged and play a larger or smaller role. So certainly a pandemic's pretty straightforward that public
right.
health is going to be lead. If it's something like flooding, we're more of an ancillary role. So in the past, there's been floods where perhaps we need to get out and our volunteers have been able to help to assure people have resources they need, but we're more of a supplementary resource.
Gotcha.
And then for funding, we certainly work if there's FEMA reimbursement. We work as a part of the county to assure that costs are being recouped if there is an opportunity for that.
Oh, great, thank you.
okay. So I'm just getting everything clear here. So I guess we need to vote on that proclamation then. Is that what we're doing?
We need to move it.
Did we move it?
I don't recall us.
I would
moving
like a
it.
motion and a second to move before we make a vote.
I will make a motion to move proclamation recognizing the Medical Reserve Corps volunteers.
Thank you.
Sanchez seconds.
Julian Sanchez, thank you very much. Please call the roll.
Juby,
Juby, aye.
Genesis,
Genesis, yes.
Tarver,
Carver, yes.
Sanchez,
Sanchez, yes.
Strathman.
Strathman, yes. Okay, thank you for that great information. Okay, Michael, the next one. We have a resolution for authorizing the acceptance of the IDHS Reimagine Public Safety Act Community Covenant Grant.
Great. So this is a continuation grant. It's funded through the Illinois Department of Human Services. They looked at communities in Illinois that had higher rates of gun violence And Aurora just barely made the list. It's actually out of the almost 30 communities that we have. It actually has the lowest rate of gun violence, but because it's the second biggest city, the number of shootings was enough to get it on there. So it's kind of a mixed bag. We're glad to get the funding to do this. It is a convener grant. So what this grant provides is for us to have a person who pulls together people in the community, including law enforcement, other parts of the city, social service organizations, community groups who may work after shootings to assist. We look at prevention, so getting gun locks out to people. And again, I always make the note when we're providing gun locks, this is for gun owners, right? And we've had presentations in the past where a gentleman we work with, Steve McHugh, has come and presented on behalf of his organization. This is not a Second Amendment issue. This is us getting free resources to gun owners so that they can safely secure their firearms.
And it's voluntary.
And it's voluntary, right? And it's a free resource. We also have biometric safes where we work with gun retailers to provide those again for free to people. The number of guns who are stolen out of vehicles or out of homes that are then used for crimes or people in Kane County, it's different than most counties in Illinois, but in Illinois, the number one method for suicide is a firearm. So we want to make sure that our guns are secure, not only to keep them from being stolen, but to keep them from being obtained by somebody who may be having thoughts of self-harm to themselves. So this is a great project. It's been going for about 2 years where we've convened a group. And again, it's working very closely with the city of Aurora, with the police department, with other community organizations. I think we have some big wins where we've helped other community organizations in Aurora get funding so that they can do more work with youth development and job training and things like that. So we can go upstream a little bit to see what some of the social factors are that may influence gun violence. So this is just step one to get permission from the board to enter into the agreement. We're still waiting for official notification from the state on this, but it's been kind of odd this time. They've given us like 3-month extensions and then another 3. I mean, it's just tied up with the state budget. But now this will be for a full year for the 121,000.
So I need a motion and a second, then discussion.
Sanchez moves.
Sanchez moves.
Pennis is second.
And this is second. Thank you. Any questions? Yes, Mr.
I just have to ask, 1 cent? What is that?
I don't know.
Is that what it cost us last year to run the program and they just matched it, or
Yeah,
like, where do they get a penny?
Benjamin Franklin said, mind your pennies and your dollars take care of themselves. I don't know.
Every penny counts.
Yeah. In for a penny and for a pound? Is that, I don't.
I think they evenly distributed through the communities that were identified as high risk. So it probably is just the way the math worked out. But yes.
Madam Chair,
Yes, Mr. Pennis.
are you working with the sheriff's office on this program at all? Are they?
Oh, yeah, from the very beginning. So when we first formed, the sheriff's office has been involved. Yes. It's interesting. And I should clarify, this is really looking at Aurora specifically. But yes, the sheriff's office is.
Aurora Police Department?
Yes. Yes. But the sheriff's office still has been involved. Yes.
Any other questions or comments? Okay, please call the roll.
Juby,
GBI.
Genesis,
Pennis is yes.
Carver,
Carver, yes.
Sanchez,
Sanchez, yes.
Strathman.
Strathman, yes. Okay. Now, I need a motion and a second for the resolution authorizing the acceptance of amendment to family-run organization agreement.
Pennis moves.
A
Juby
second.
seconds.
Okay. Michael,
We like this because it's a nice round number. And there's lots of numbers, which we like quite a lot. So this is specific to what we call FROs, family-run organizations. So about 8 years ago, we started through our early childhood work, really intentionally trying to engage parents and increase capacity. We work with an organization called Kofi out of Chicago, where we started doing training with parents to not only we start with themselves, start looking at their families, and then branch out into their community. I always like to brag for one of the parents that we're engaged with. She was actually critical in bringing busing into East Aurora school districts a number of years ago. So we were able to really increase what we were doing with these folks. And it's really, I don't know, empowering is kind of a different word. The people already have the power and the knowledge and things. So it is really just creating opportunity for that parent voice to be there. When we received funding from the Illinois Children's Healthcare Foundation about 6 years ago to start our children's mental health system of care, parent and youth engagement was a key component of that. So we've really invested in that, in supporting our parents. They participate in school board meetings, they participate in city council meetings, they engage other parents. We received, and you gave us permission to accept a $150,000 grant several months ago. And we just received one of those really fantastic messages a couple of weeks ago where they said, we've just identified through the Illinois Children's Healthcare Foundation that we have an extra $1 million that we're willing to invest in your project. So this is something that's very exciting to us, that the end goal, and I think this is great for our methodology for a lot of things, is for us to launch it. So we're putting resources into it now. This is to really support the formation of a not-for-profit organization that is a family-run organization that will still continue to work very closely with, but it'll be self-governed and really be autonomous from the county. So this is just a win-win. There's also some additional resources coming to Family Service Association of Greater Elgin, who also receives funding from the Children's Healthcare Foundation. So we'll give a deeper dive, and Mr. Tarver had asked some questions about plans and things like that. This is just a couple weeks old. So we're putting the final budget together, and this is just asking permission to accept the grant. But Director Peterson and Maria Leone from our team, who organizes the Children's Mental Health Project right now, have been doing a fantastic job with this. So we'll give a much more in-depth presentation. And we've had the parents come and present before, and I know the board's really enjoyed that. I don't, any other highlights you want to say, or do you want to save it for a bigger presentation? Okay, we'll save it. So stay tuned.
Yeah, this is very exciting.
Very
and
exciting.
You should be very proud, because this is a program that has shown what you can do, and they're taking it on their own. And it's just such wonderful, pure support. It's fabulous. So
Great.
thank you and congratulations. So can we take a vote for that?
Doobie,
Juby, aye.
Genesis,
Genesis, yes, and congratulations.
Tarver,
Tarver, yes.
Sanchez,
Sanchez, yes.
Stratman.
Strathman, yes. Okay. Moving right along. You have anything else you want to add to us this morning? Great report. Thank you very much. Thank you. Any old business this morning? Anybody? Okay. I'd like a motion and a second to replace the reports on file.
Sanchez asked for unanimous consent to place reports on file.
Okay, thank you. Any objection? Seeing none, that'll be done. Okay, I don't think we have a need for executive session. Any new business? Yes, Mr. Sanchez.
Thank you, Madam Chair. Yeah, I just kind of wanted to follow up on something I know we've discussed, but I think maybe we'd be able to bring it forward. I'd been contacted by one of our East Dundee trustees, Sarah Britton, last year, or maybe even the year before, about the allowances for like dogs on patios at certain establishments outdoors, of course. And I think we were waiting for the FDA to update their rules, and now that's come in. Illinois has accepted it. So now we're in a position where we can make that adjustment. So I just want to see if that's something we can bring forward, maybe even for next month. The weather's getting nicer. I think a lot of our business owners would just like to know it's not going to be an issue as long
Yeah.
as
And I
everybody's
think that would
reasonable.
be, a lot, the public is very interested in that
Yeah.
as well. So,
And we had pitched that over to the state's attorney's office, and I know there was a little bit of a transition, so I'll follow up with them today and see if we can get moving on that.
Great. Thank you.
okay, thank you.
Madam Chair,
Any other new business?
Madam Chairman.
Alex.
Oh, yes, Alex, I'm sorry.
Okay, yeah, am I loud enough?
Sometimes.
Okay, sorry. I'd like to acknowledge that Dr. Monica Silva, our King County Coroner, is present. I want to defer my time to her.
Thank you, Board Arroyo. I'm not on the agenda, just Madam Chair, I don't know if you would like me to say something, but I am here for learning purposes. I can comment on whatever you'd like to whatever you'd like for me to comment, or I can let you end your agenda, but I am here for learning purposes.
Thank you, Dr. Silva. We always welcome you. And are you saying you're going to join us on a regular basis when you can?
Yes, actually, I was I had it on my schedule to join you today. However, I worked very early into the morning hours today. I was not able to make it in, but I get to work with these wonderful people that are present there on a regular basis, and these are wonderful programs. I can more information about what my first 6 months in office have, but we have, I'm sure most of you are aware that we have been able to compile aggregate for veteran suicides. In the process of doing the same thing for overdose deaths in county, and in the meantime, also working with a very talented, educated, passionate staff. So things are coming along despite some of the things that we have to work with. So I think that's all for now. I'm sure you'll hear from me quite a bit more.
That's great. Thank you. That we always welcome that information. Thank you.
You're very welcome, Madam Chair.
Okay. Okay. I think we're done.
Madam
for
Chair.
A crazy meeting this morning.
Quick
Yes,
question, just for Michael. Michael, thank you. Any updates on Corbella adding them to the website for pregnancy resource?
Okay. Dr. Peterson, any progress on the Cabela Clinic for Iris, if we were able to add them?
I don't think anyone reached out to me. So if you can just,
We'll follow up. Yeah,
or I need the contact person. Yeah.
Okay, I'll get it.
Thank you.
Okay. So I need a motion to adjourn.
Sanchez moves.
Second, I guess. All in favor?
Aye.
Aye. See you next month.